Now we are going to see about thorax. What is thorax? As a student, how we are going to approach the thorax? What are the important structures you need to concentrate? Now I'm going to say about all this. This is the thoracic cage. Inside the thoracic cage, we have important organs like a pair of lung, and in between we have a heart. So, how we are going to approach? The thorax is formed by a cage that is called thoracic cage. It is formed by skeleton and cartilage. That means bones and cartilage. What are the bones and cartilages forming the thorax? Anteriorly, sternum, manubrium sternum above it. Posteriorly, we have rows of vertebrae that is called thoracic vertebrae. On either side, connecting these two structures are nothing but ribs. We have 12 pairs of ribs. So these are the structures forming the thoracic cage. We have two openings, inlet and outlet. The inlet will have the neck structures. That means we have arteries, veins, tubes. Tubes means esophagus and trachea. All these things are present in the inlet. Now, if you see here, the ribs are attached with the sternum through cartilages. You can ask me, why we need a cartilage? What is the function of a lung? Respiration. You need to do inspiration and expiration. So, to accommodate the inspired lung and inflated lung, you need to have a flexible ribs. So we have a cartilage in between the rib and the sternum to give that flexibility. So the rib moves, you know very well, the bucket handle movement and pump handle movement, these are happening during inspiration and expiration. Having said about this thoracic cage, I just wanted you to focus on what are the organs present inside. Now, in the next picture, I've just removed the anterior part of the thorax. Now, you have to concentrate on the organs. The centrally placed heart, on either side we have lungs. How we are going to approach? For example, lung, because these two organs are important organs. Apart from these two, we have several other organs are present, but as far as exam concerned, you have to focus on these two organs. So better you start with these organs. You just go to the lung. We have a pair of lung. Lung is covered by pleura. You have to give importance to the pleura. If you see here, we just removed the heart and you can see that exposed lungs. If you see here, the lungs are covered by a thin layer of connective tissue that is nothing but pleura. So you start with the pleura. Pleura is a covering of the lung. Two layers are there, parietal and visceral. And about their attachments, extensions, and if anything like pulmonary ligament or any spaces, you have to concentrate on that because all are clinical related questions. So you just have to concentrate on pleura. So extension of the pleura, different types of pleura, and any spaces or extra spaces are present in the pleura. Next, lung. We have pair of lung. Almost it has a similar structure, but gross wise, if you see, you can differentiate right from the left. So what you have to focus on the lungs? First thing, gross appearance. How many surface, how many borders, poles, base, all these things you have to learn. So morphological features about the lung. Then how we are going to identify or distinguish right from the left. Right side 3 lobes, left side 2 lobes, right side 2 fissures, left side only one, that is oblique. Right side you have a horizontal on oblique fissures. You have to concentrate on all this. In the mediastinal surface, You can differentiate right from the left by seeing the impressions. On the right side, you have a arch of ascicus, on the left side, arch of aorta. All these things you have to concentrate, because in the exam, the mediastinal surface can be asked in the diagram question. So concentrate on it. So morphological features of a lung is important. You need to understand what is bronchopulmonary segments. So after knowing all these morphological features, you are going to see inside the lung, for which you just start with the trachea. Trachea is there, it divides into two principal bronchus. The principal bronchus enters into the lung. There, the secondary bronchus started appearing, and they are called lobar bronchus, because on the right side we have 3 lobes, left side we have 2 lobes. And the lobar bronchus further it divides into form segmental bronchus. That is what called bronchopulmonary segment. Now, each segment of the lung will have a channel which is called tertiary bronchus or segmental bronchus. So only that channel aerates a part of the lung. So it is called a bronchopulmonary segment. And if you see that how many bronchopulmonary segment on the right side, left side you have, you need to draw a diagram like this in the exam if they ask. So on the right side as well as on the left side, we have totally 10 each bronchopulmonary segments. So you need to know in order. So you can have any sort of mnemonic to remember the order. So upper lobe, mid lobe, lower lobe, how the branches are given. That means the segments are placed in the lung. You have to understand the clinical importance of this bronchopulmonary segment. Coming to the clinical aspect of the entire lung, we studied the pleura. So what is the clinical aspect of the pleura? So we have a pleural space in between the parietal and the visceral pleura. So that space, in case any injury or in case any infection, that space will get a fluid accumulation. If the fluid accumulates between the two pleura, that condition is called the pleural effusion. If blood accumulates between the pleura, that condition is called hemothorax. If air gets accumulated between that because of injury, that is called pneumothorax. So several clinical aspects you can learn. The blood or the water, whatever the thing, it will get collected in a space between these two in a lower base part, that is called costodiaphragmatic recess. So you have to concentrate on costodiaphragmatic recess. Next thing regarding the lung. So when you say about the bronchopulmonary segment, why you want to study about the bronchopulmonary segment? You have to apply your clinical knowledge. In case of upper lobe, tuberculosis can happen. Which segment? Upper apical lobe. That is how you have to learn. One segment is aerated by an individual tertiary bronchus. If it gets blocked, then that particular segment will undergo collapse. That particular segment will have their individual artery supply, but venous drainage of that particular segment is common for the adjacent bronchopulmonary segment. So the pulmonary veins will be seen between the two segments, and pulmonary artery is exclusively for the segment. So you have to understand this. You can do segmentectomy if any segment is infected or it just undergoes any changes. So you can do a segmentectomy. It is possible. Next thing, as we discussed about the lung, where do you have to concentrate? In between the lung we have heart. The thorax is divided into certain areas that is called mediastinum. So between the two lung, the space between the two lung is called mediastinum. It is divided into many areas. If you draw an imaginary line through T4 vertebra, it crosses manubrium joint anteriorly. So the structures present above that line are under superior mediastinum. Below that line all are present in the inferior mediastinum. Inferior mediastinum is further divided into anterior, middle, posterior. Now, how do we separate this anterior from the posterior? It's very simple. Where the heart is present, that is middle mediastinum. So the heart is present in the middle mediastinum, and in front of the heart is anterior mediastinum, behind the heart is posterior mediastinum. It's very simple to understand. Now, since we are concentrating on the middle mediastinum, that is about the heart, what you need to know about the heart? So in the exam, it is inevitable. The heart, how question from the heart, definitely it will be asked. So you have to be ready. So what you are going to study about the heart? Simple. First, know the orientation of the heart, where the right chamber, right atrium, right ventricle, left ventricle, then behind the left atrium is there. This is how the chambers are arranged. And you should know the surfaces, borders of the heart. That is called external features of the heart, where the aorta comes, where the pulmonary trunk comes, and the inferior superior vena cava positions. Then the grooves, atrioventricular and interventricular grooves. You just study about the external features. So this is the posterior view. So you can see that the heart has apex and base. The base is mainly formed by this left atrium. You should know that it is present in the posterior region, and this surface is called diaphragmatic surface. Now, if you get oriented to that region, means you can enter inside the heart. Just do a dissection and you can see the chambers. What are the chambers? We have right atrium, right ventricle, left atrium, left ventricle. Among these chambers, which you want to concentrate, right atrium, because we have several features in the right atrium. Development of the right atrium is important, and the structures present in the right atrium is important due to the development. So concentrate on right atrium. We have fossa ovalis, limbus fossa ovalis, tendon of Todaro, triangle of Koch, Thebetian veins opening, inferior vena cava, superior vena cava, and coronary sinus openings all are present here, including the crista terminalis and the musculi pectini. So all these are features of right atrium. Please focus on the right atrium. And apart from that, you can just focus on the leaflets. How many leaflets on the right side? Mitral valve, tricuspid valve, and then papillary muscles. I mean, inside the ventricles. So how the right ventricle is different from the left ventricle. The difference between these two. How many papillary muscles are there, and how the cusp is arranged. So all these details you can study about this. Next is important thing. Several times so far they have asked in any exam, university exam from any state, blood supply of heart. So we have two important arteries, right coronary artery, left coronary artery coming out of it. Here the red color shows the right coronary artery and the green color shows the left coronary artery. Usually that is should be a red color to differentiate the right from the left. We just color the left as green, and the blue is actually a vein. So right coronary artery, left coronary artery, both are coming from the aorta, and how the course of the both arteries are going, the distribution of their branches, of everything you have to study. And what is coronary dominance? Who is supplying SA node? Who is supplying AV node? Bundle of His, everything you should know, including the interventricular septum, because the question will be based on that. And you need to know the applied aspect of it, nothing but myocardial infarction, block in the artery, which is the commonest artery, to get that block, and what would happen. So they'll give you a clinical scenario about the myocardial infarction. You have to diagnose and you have to write about the blood supply of the heart in detail. So blood supply means arterial supply plus venous drainage. So venous drainage, it is also important. Coronary sinus, they can ask like, because coronary sinus, you please concentrate on coronary sinus. What is the location of coronary sinus? Where does it open? What are the tributaries present in the coronary sinus? I mean, opening into the coronary sinus. This is the thing you have to concentrate. Next is, you have to know about the conductive system of heart. It will be helpful in understanding the physiology of the heart also. You need to know where the SA node, where the AV node, where the bundle of His is present in the heart. How the SA node is connected with the AV node through three routes. the names of three roots, everything you should know to understand the physiology. So, conductive system of heart also you have to concentrate. So now we just finished the heart, which is present actually in the middle mediastinum. In front of the heart, we don't have much structures. We don't have important structures. Only the ligament, sternopericardial ligament, and certain lymph nodes, and even part of the thymus will be there. But behind the heart, we have important structures like the green color shows nothing but the esophagus. It's a tube. Another thing is the descending thoracic aorta. It's a tube. So tubular structures are present. In addition to these two, we have azygos vein, thoracic duct. These four structures are highly important. Anytime they can ask. You can ask me, then what about the superior mediastinum? Exactly, you should know the superior mediastinum structures also, because if you just see that this is the T4 level, above that you have all these great vessels. Arch of aorta comes, branches of arch of aorta, pulmonary trunk comes, superior vena cava, formation of superior vena cava. All these are present in the superior mediastinum. So you have to concentrate on the superior mediastinum also. Structures present in the superior mediastinum and arch of aorta, branches, all this. Next is the same thing, only just enlarged picture to show that how the arch of aorta and the descending thoracic aorta, trachea, and then bifurcation of the trachea, then esophagus. Then going to the next picture, you can see I just added a few things on either side of the midline. You can see a yellow color structure. You can see the yellow knots. That is nothing but the sympathetic chain. So you need to know what is sympathetic chain, how it is placed in the body, and how it is connected to other nerves. Then what are the different nerves from the sympathetic chain? For example, greater splanchning, lesser splanchning, least splanchning, all are present here, and it is getting into the abdomen through diaphragm openings. So the sympathetic chain, you just concentrate. Along that, we have another nerves. Important nerve is the phrenic nerve, right and left, and vagus nerve. So phrenic nerve you can study in detail. Vagus nerve, it has a long course. Just to have an idea about vagus nerve. Here, azygos vein as well as thoracic duct. A vein means, already I just told you, commencement and the termination of the vein you should know. Then the tributaries, various tributaries of the vein. So azygos vein will have all this commencement, where does it starts, where does it end, and what about the tributaries of it. Then applied aspect of it. Same way for the lymphatic system, cisterna chyli, that is the beginning portion of the thoracic duct. So what about the course of the thoracic duct? Where does it cross and how does it end? Where actually it drains? It is just a junction between the left internal jugular vein and the left subclavian. So you have to specify how it is present, what about its course, what about its relations, and where does it drain, and finally applied. What is the applied anatomy of the lymphatic system? That means thoracic duct.